So, a lot of people have questions about how do I manage my other conditions as we are working on weight loss? And some of those conditions might be sleep apnea, it might be high blood pressure. There are some people with non alcoholic fatty liver disease, which is also called metabolic associated liver disease. What do I need to do in order to treat those things? Um, and generally speaking, whatever you are currently doing is going to be continued until we feel like we can try stopping it. So, blood pressure would be the most common example that somebody has been diagnosed with high blood pressure. We are starting our weight loss journey. It typically takes 5 to 10% weight loss in order to see changes in blood pressure. And so, usually, we're going to continue blood pressure management until we're in that range of 5 to 10% weight loss. And then we might try reducing doses or stopping doses of blood pressure medicines and seeing what does the blood pressure look like. We do have a few medications such as phentermine, lisdexamfetamine, which is Vyvanse, or phentermine topiramate, which is Qsymia, that can slightly increase blood pressure. So they might slightly increase blood pressure, and we see that as a fairly temporary effect in that if they are successful in helping people to lose weight and people get to that 5 to 10% weight loss, often their blood pressure will go down. We've reduced one of the factors that is contributing to the high blood pressure in most people, and that often leads to improvements in blood pressure. So people have been leery to use stimulants in people who have blood pressure, but when blood pressure is well controlled with another medication, we can often safely use our stimulant medicines to manage it. When people have liver disease, when they have diabetes, when they have heart disease, we are generally going to be continuing their treatments with weight loss. But again, as weight loss has happened, sometimes we can be able to come off of medications. And that is quite individual. There are some medications, for example, if someone is on cholesterol medicine, they might ultimately stay on cholesterol medicine, especially if they have diabetes or heart disease, because that is usually seen to be beneficial. But there might be other people who have a really dramatic improvement who don't have diabetes, who don't have heart disease, and sometimes those folks are going to be able to come off of medications. So you can see that it's really important that you're working with someone who is able to either manage those conditions themselves or is consulting with other people, other prescribing physicians or providers who are managing those conditions alongside. We need to work together to look at the overall health picture, which is why it's really important that you have a care team that you can trust. It's really essential that we're managing chronic disease, that we're sort of monitoring for improvements, and that really helps us to provide safe, excellent, high quality care.